This is Dr. Epstein with a patient who's going to have her nose done. Actually we'll do it in the next couple of days, but I'm here today. We're here just to go over her computer imaging. This is something I usually send to patients by email, but she wanted to come in to go over it and just go over all the details of her surgery. She's scheduled for her rhinoplasty in the next day or two. She's in her early 20s, great candidate, she's tall, thin, just has some features with her nose with which she's unhappy. She's sitting next to me, but I'll show you her pictures first, because I also have her computer imaging. Can you see this, Cindy? And we're focused in. But basically, obviously this is going to be nothing better than the real thing, but you can see that she's got a somewhat wide bridge, a little bit of a fullness more on the left side than the right of her nasal tip. That's really her only complaint in front of you. This is the computer imaging, and I went over these with her. And this is, to show in front of you what I like. But this is the better view. This is her profile. As I said, she's quite pretty, but she's mainly concerned about the bump that she feels takes away, draws attention away. We went over her computer imaging, and I actually showed her two different versions of an after. This is why I find computer imaging to be so valuable. This is subtle differences. This is one version. This is the other version. You can see with this version, as opposed to what she had, generally with my noses I like to create a nice straight profile, and we've done that here, but the difference is on this one we have a well-defined super tip break. So this is the tip, this is the super tip region, and there's a break, which means a slight indentation. Here it's smoother. Most patients, I think, generally look better with a slight super tip break. It's a very personal decision, but it's something which I prefer usually. But in this case, we decided, and I agree with her, that the lack of a super tip break is actually going to work better for her, and you can see how nice it is. So here she is, preoperatively. She's smiling. Let's take a look at her. So basically, let's talk about the nose. She's got a wide dorsum, a wide bridge rather, an over-projected dorsum. She's got well-defined tip. When she smiles, smile for me, it doesn't really droop, which is nice, so she's got nice cartilage. This is what's called, you can stop smiling if you want to. This is what's called a double break. It's where the columella becomes the tip. She's got a really nice, well-defined double break, which is very difficult to achieve surgically. We can do it, but she already has a natural one. But obviously this is her main area of concern, is the bridge, which is over-projected. This is bone, this is cartilage. So it's a combination of bone and cartilage. We're going to take that down, give her a nice straight look, reset the bridge, and do a little bit of refining of the tip, just a little bit. She's got these really nice facets, these soft tissue triangles, which are really pretty. We're just going to go ahead and do a little bit of refining. Make sense?
Yeah.
And that's what we got. So this is Dr. Epstein, and I just wanted to go over how I do computer imaging, and also to show a real-life patient. And if you stay tuned, you'll actually get to see her post-op photos or post-op videos, so that'll be nice. Anyway, thank you, and thank you, patient.